a busy shift, and I got activated for allergic reaction, which is most of the time not very exciting, just a mild rash or like mild, symptoms. But when I saw this patient, I panicked. He was like a middle-aged man, short neck, a little bit more on the obese side, and he was gargling, very gargled, muffled speech, big tongue, lips were really swollen. When I asked him to open his mouth, I could barely see the back of his throat. So that sounded off many alarms. We called ENT. They also panicked because they're like, you need anesthesia to come here right now before even scoping the patient because of how bad he sounded. When we asked him to open his mouth and we put like a tongue depressor to see, want to see the back of his throat and assess his airway a little bit better, his uvula popped out and it was the size of my pinky. So that was very, very challenging and brought up many questions. We had given him all the appropriate medications, epinephrine, and all the other medications, but it was really concerning. We had anesthesia come down across the bridge. They brought all their equipment, many bronch trees, and like on our side, we were preparing, knowing it will take some time for all of our consulting services to come. We were preparing our own airways, had a scalpel waiting at the bedside. So that was a very challenging airway. I knew he would be a very tough intubation from the oropharyngeal standpoint because his soft palate was so swollen. His uvula was the size of my pinky. His tongue was huge, and he also had some very difficult anatomy. He had a shorter neck, very obese. So even for doing a surgical airway would be a little bit more challenging as well. So I definitely was very unsettled by this airway. I think the takeaway for me was, to have a low threshold to call my consulting services, because ENT was able to offer some advice on, maybe he would benefit more from a nasotracheal intubation because his oropharynx was so swollen and they don't have the, right bronch size or like the right length that would go deep enough to do that, and anesthesia would need to come. And knowing like which hospital we were at, I knew that would take a very long time. So just having all these experts in airway at the bedside with me helped calm me down, and also was, better for the patient, even though eventually we did not do anything. To me, while also preparing ourselves to intervene if needed, knowing, that it may take some time for these consultants to arrive. So I feel like that for me was the takeaway, hearing a muffled voice, seeing the anatomy, seeing how gargled he was, just activating everyone to come and have as many hands as possible at the bedside.